Hello guys. So today we shall be discussing regarding the facial nerve. Okay. So we shall be mainly focusing on the facial nerve anatomy, in which we shall be discussing the course of facial nerve. Okay. How the facial nerve is passing, and through which foramens does it pass, how many branches does it give, right? So all the things I wanted to discuss it with you, and purely with the help of diagrams. Okay. So I have drawn here, I have drawn these pictures. I'll zoom into these pictures and then I will explain you complete facial nerve. And I'm telling you that this is really a difficult topic. The reason why it is a difficult thing is that there are many branches that take many turns. Okay. And there are many branches that join with other branches also. So anyways, you might already have studied facial nerve, right? Even if you're studying for the first time, so I have prepared lecture in such a way that even if you're studying for the first time, the concepts will be completely clear. So it might take a bit of time, maybe 20 minutes, 30, I don't know how many minutes the lecture is going to be, but this will be fruitful. Because why am I teaching facial nerve so detailedly is that next video will be on the lesions of facial nerve. To understand that, that will be a very short video, 10-15 minutes. Okay, to understand that, you have to understand this course. Okay, so facial nerve is very important for your exams, and especially in medicine, the neurology part, most of the stroke patients, they come with the facial nerve palsies. So you have to understand the facial nerve. Okay, let's get started right now. Okay, so very basic thing, let's start from the complete basic. Okay, instead of directly going to the nuclei, etc., let's start from the complete basic. So if you look at the facial nerve, all of you know facial nerve is your seventh pair of cranial nerve. That is why I'm not writing it. Okay, so facial nerve is your seventh pair of cranial nerve. So all of you know this particular point, right? Now, important thing you have to understand here is that, just look here, whenever we are discussing regarding the facial nerve is a mixed nerve. What do you mean by mixed nerve? It has got both sensory fibers, at the same time it has got motor fibers as well. Okay, so facial nerve has got both your motor fibers as well as sensory fibers. So there are two groups of fibers. Okay, one is motor, another one is sensory. So if there are two groups of fibers, then obviously nuclei also will be two groups. We have got motor nerve nuclei, we have got sensory nuclei also. So there are fibers that are exiting out of the motor nuclei, and there are fibers that are entering into the sensory nuclei, right? So we shall discuss what are those fibers. Guys, whenever you study the course, the first thing you will start with is some structure of brain and nuclei, and you see fibers running out of the nuclei. So that is what we are discussing right now here. Okay, so the first important thing is your motor. Okay, now if I have to discuss motor branches, first of all you should know how many motor nuclei does this particular part has. Okay, so there are two important motor nuclei. Where are these motor nuclei? I will show you in a minute. I'm just trying to explain you, brief up the things here. So facial nerve has got two motor nuclei. The first motor nuclei is called as facial nerve proper nucleus. फेशियल नर्व प्रॉपर न्यूक्लियस, ये कौन सा न्यूक्लियस है? ये मोटार नर्व का न्यूक्लियस. दिस इज अ मोटार न्यूक्लियस. ओके, नेक्स्ट इंपॉर्टेंट थिंग is superior salivatory or salivatory nucleus. How many nuclei we have got? Superior salivatory and facial nerve proper nucleus. ये कौन सा न्यूक्लियस? सेंसरी न्यूक्लियस की मोटार न्यूक्लियस? मोटार न्यूक्लियस. नाउ अभी यहां से जो फाइबर्स निकलेंगे फ्रॉम द फेशियल नर्व प्रॉपर न्यूक्लियस, जो भी फाइबर्स निकलेगा यहां से, these fibers are called as motor fibers. But what kind of motor fibers? They are called, if you look at the fibers that are coming out of this facial nerve proper nucleus, what are these fibers called as? These fibers obviously are called as motor fibers, but what is the other name here extra? You have to know it as somato motor fibers. So these fibers are your somatomotor fibers. Then when it comes to the superior salivatory nucleus, even there are fibers that are coming out of the superior salivatory nucleus. These are also called motor fibers. But what motor fibers? They are parasympathetic motor